Now, as part of efforts to eradicate malaria in Ghana, government has launched the National Malaria Elimination Strategic Plan. The plan, amongst other things, aims at reducing malaria mortality by 90% by the year 2028 and to reduce malaria incidence by 50% going into that year. Launching the strategic plan, the sector minister, Kwekwachi Menu, expressed his optimism that Ghana has the capacity to eradicate the disease considering the successes of the National Malaria Control Program.
Malaria has remained a priority disease under the government's policies and initiatives and has traveled several progressive milestones to ensure high coverage of evidence-based interventions to combat malaria through the National Malaria Control Program and now the National Malaria Elimination Program. The control program, for instance, aimed to achieve the following goals by 2020. 100% of communities will have access to community-based treatment for uncomplicated malaria. 90% of caretakers and parents will be able to recognize early symptoms and signs of malaria. And 90% of children under 5 years of age with fever will receive an appropriate anti-malaria treatment within 24 hours. On the other hand, the National Malaria Elimination Program was established to reduce malaria morbidity and mortality rates by 75% by 2020, using 2012 as a baseline. Some of the key interventions and strategies implemented by the elimination program include distributing long-lasting insecticidal nets nationwide through health facilities, communities, and schools, rolling out guidelines for malaria case management, malaria in pregnancy, laboratory diagnosis of malaria, and anti-malaria drug policy in all our regions. Conducting supervisory visits to public and private health facilities, monthly data reviews, routine data quality audits, and monitoring of activities of epidemiological sentinel sites. Indoor residual spraying in targeted districts. In 2000, we committed to the Abuja Declaration on rolling back malaria in Africa and the Millennium Development Goals, MDGs. And finally, in 2006, we also committed to malaria elimination in Africa. Distinguished ladies and gentlemen, we have made significant progress in reducing the burden of malaria in the last decades. With smart investments, strong and enduring partnerships, a dedicated workforce, and effective leadership, we have reached millions with life-saving interventions. Malaria-related deaths at all ages reduced from 3,889 in the year 2008 to 155 by the end of 2022, which is about a 96% reduction.
Director General of the Ghana Health Service, Dr. Patrick Kumapaju, also stressed that the negative socio-economic impact of malaria makes it imperative for the country to eradicate the disease like other countries have done.
That the socio-economic impact of malaria, has been said already, is significant. The disease imposes a heavy economic burden on households, the health system, and the national economy. Malaria-related illnesses and deaths lead to lost productivity, absenteeism from work and school, increased health care costs, as well as personal costs. This can result in reduced economic growth and development. It is therefore the desire and wish of the government that the two committees will help avert the above impact by working hard to support the service and all other stakeholders to eliminate the disease. Distinguished ladies and gentlemen, let us all leave here with the conviction that all hands will be on deck, as was shown, to ensure malaria-free country. Let's remember that zero malaria starts from me and you. We all have a role to play, and I will urge you to put on your best effort to make it possible, as the government also does its part. We have done it before for guinea worm eradication, and we can also do so for malaria.
Representing the presidential advisor on health, Dr. Nsia Sari, mentioned that this plan wouldn't just sit on the shelves, adding that government has the political will to ensure the full implementation of the strategic plan.
A more robust partnership is required to end malaria once and for all in Ghana. I'm abreast of the multi-sectorial engagements that culminated in the development of this National Malaria Elimination Strategic Plan. I'm happy about this effort and commend the various sectors, ministries, and agencies who availed themselves to contribute to this document. The National Strategic Plan will be a guiding document which seeks to build on the progress the country has made so far. The plan, which is built on inclusiveness, sustainability, empowerment, and resilience, clearly defines the strategies necessary to accelerate progress from malaria control to malaria elimination. I therefore call on all sectors, ministries, agencies, both public and private sectors, to fully take ownership of the document and together work with the Ministry of Health and the Ghana Health Service to fully implement the plan activities. The approach the nation intends to use is a sub-national elimination approach to achieve malaria elimination in a stepwise manner. Ghana is characterized by varying disease levels elimination, which will target areas of lower malaria levels to those of higher levels. I'm confident that this plan will guide the nation into zero malaria. I know it is a monumental task. However, considering the progress made so far in recent years and the efficiency of the interventions at our disposal, we are well able to accomplish the goal we have outlined ourselves as a country. I take this opportunity, therefore, to assure you of government's commitment in providing the political will and the resources to support the deployment and implementation of the various strategies and elimination activities. Government is ever prepared to play the necessary leadership role for malaria elimination in Ghana. In launching this path to elimination, private sector involvement is very imperative. In addition to government support, private industry investment is critical in realizing the malaria elimination goal and to help build stronger health systems. Innovative mechanisms are required to mobilize resources domestically and internationally to augment existing resource streams, including donor contributions, thus closing the national funding gap, which the program manager spoke about.
Well, Dr. Kezia Mal is program manager for the National Malaria Elimination Program, joining us in studio now. Thank you so much for spending some time with us here on The Pulse. The agenda is Agenda 2028, but how are you working towards achieving that?
Thank you very much for having me. As the presidential advisor said, this is a sub-national elimination approach. What we've done is to zone the country into 4 based on the malaria transmission. Some parts, especially specifically the Greater Accra, where we are sitting, is the areas with very low malaria. And then we have other areas that have low malaria, moderate transmission malaria, and then high transmission. So based on these zones, we are going to add on interventions and then gradually reduce malaria or eliminate malaria stepwise. It's not a one-time approach. It's a process that will take us some years, but we are starting now.
Practically, what are some of the activities you're going to be engaged in? Because we know that education has been a major concern, the fact that people are still unaware of what to do, how to keep their environment clean. what more steps will you be taking in the coming years?
So we would enhance the education further. What we are also going to do is tackle the mosquito a bit more. As you are aware, we started tackling the breeding sites of the mosquitoes to kill the baby mosquitoes in by spraying. What we intend to do is to work with other ministries more now to reduce the number of breeding sites. In addition to tackling the vector more, we also intend to tackle the parasites more, and we're going to do that by expanding chemotherapeutic interventions. What I mean is interventions that require taking medicine. Yeah. So currently we do some preventive interventions that require taking medicine, like intermittent preventive treatment for pregnant women, for children under 5 in some regions. We intend to scale that up so that it's not only children under 5 that would take those medications. Currently we do it for 4 times. Now we are going, this year we are going 5 times. We hope to increase the number of children. We hope to try that in school children. For the areas where we have very low malaria, I hope to be able to do it in the entire population and even expand the malaria vaccine to cover the whole country.
Is it Cape Verde or one of the countries, of course, that's very big news that they are almost dealing or eradicating malaria. How is that serving as an inspiration to Ghana, for instance, towards meeting our targets?
We are so inspired because it's an African country. Yes, it is an island, so it might be easier, right. And it's a smaller country, but it's an inspiration for us as Africans to show that we can do it. Cape Verde becomes the 3rd country in Africa to be declared malaria-free, showing that if we put in the effort that is needed, even the current interventions can help us get there.
So how are we faring as a country?
As a country, as we showed today, we've seen a great reduction in the number of deaths recorded in our health facilities. Now we are recording just around 150 deaths in our health facility. Of course, every death shouldn't happen, and we are working towards at least by 2028 that we should be counting deaths in very single digits or even 0. We've also seen a reduction in the malaria parasite prevalence in children under 5 who are mostly affected by malaria. Now we have, the rate is 8.6%, so it means if you take 100 children, we have 9 of them being positive for malaria as compared to about 10 years ago when we had over 25 of them being positive for malaria.
If there's a message for the people of Ghana and what we need to know about what your outfit is doing and what you equally need them to do to support this fight against malaria, what would that be?
So what we are saying is that malaria elimination is possible. It's a daunting task, but it's something we can do if we all put our hands on the deck. That will require that you would ensure that you don't create breeding sites for mosquitoes. You take your medication if you are sick, use any of the preventive interventions, and let's all work together to eliminate malaria.
The point about policy interventions and how that can also deal with the challenge, access to treatment, and also the ability of people in remote areas and rural communities to be able to afford these services. How are you working on pushing these reforms as well?
So currently, in fact, malaria is the highest expenditure for the National Health Insurance. So when it comes to treatment, it is covered by the National Health Insurance once you are registered. So we encourage more and more people to be registered. And most of the preventive interventions, like the use of mosquito nets and then indoor residual spraying, we distribute them for free. It's free. It's quite expensive, but people get it for free because of how we see important malaria.
Going forward, 2028, is that the only target we have, or perhaps it might even come earlier than before?
So in the current plan, we have three goals. The first one is to make sure that we get to near 0 deaths. And the second one is to get a reduction in the cases that we are seeing by 50%. And the third one is to make sure that at least 21 districts in the Greater Accra are eliminated of malaria. We get malaria elimination in those districts.
Okay, we're hoping for the best. Probably you have a final message for our viewers.
So please support us to help everybody because when I get malaria, you're at risk. When you get malaria, I am at risk. So this is for all of us. Help us to eliminate malaria.
Dr. Kezia Mallam, thank you for your time. And you're still with us here on the Pulse on the Joy News channel. We're getting back shortly with some more stories. We'll be looking at the December 7 elections and the possibility that the elections might be postponed due to a petition coming through from the SDA Church. We'll tell you about their concerns shortly.